Hello, welcome back to Open 2.0. I'm your host, Alyssa Clone, and I hope you're all staying positive and safe during this pandemic. The 2.0 crew wants to learn more about the pandemic and how the youth are affected. Joining us today is Jocelyn Lebron, the Bronx healthcare advocate of Healthcare Education Project. Jocelyn works closely with the Bronx community to advocate for our health rights on state and federal levels. Welcome to the show, Jocelyn. I hope you're doing well today. So, Jocelyn, my first question is, can you tell us about the Healthcare Education Project and the mission of HEP?
The Healthcare Education Project is a community based advocacy organization. We work in partnership with individuals, healthcare providers, and civic and religious leaders across New York to protect access to critical healthcare services, better understand the urgent healthcare issues facing our communities, and advocate for universal healthcare coverage. Our mission with HEP is to protect and expand access to quality and affordable healthcare for all New Yorkers through education, advocacy, and coalition building. Although we do not have a Bronx site, we don't have an official Bronx office because my role is a field organizer. So my role as a field organizer makes it possible to meet the communities where they are. The Healthcare Education Project advocates for vulnerable communities and healthcare workers by bringing their healthcare issues to the forefront. So I'm gifted with the capacity to be able to advocate for Bronx residents on the state and federal level. We are also able to bring educational resources to prevent illnesses and promote healthier lifestyles. So my day to day consists of just meeting with community residents, community organizations, finding out what their needs are, and of course, I can take certain concerns and issues to Albany. We do a lot of in district lobby visits to just speak about what the community is going through. They don't have a lot of times the Bronx residents are left underrepresented, so I'm privileged to be able to represent them on some level.
How has the Healthcare Education Project been affected by COVID 19?
Well, the pandemic has affected my work by transitioning from an on the grounds field worker to not only being able to contact the community by email or phone. Not being able to see the people I advocate for can be trying at a time when they need the advocacy most. But what's most important is our health right now and following the CDC guidelines. So we continue our commitment to educating the community through various digital avenues, like email and social media, which can be a very powerful tool.
For the teens that don't really understand, could you explain to them what is a pandemic exactly?
Okay, so a pandemic, simply put, is the global spread of an infectious disease. It affects large areas and mostly every continent.
Can you also help us define what is COVID 19 for the youth and older teenagers?
Sure. So, COVID 19 is a highly contagious respiratory disease caused by the COVID 19 virus. It can be very dangerous for people with weaker immune systems, and the most common symptoms are difficulty breathing, a persistent dry cough, fever, and some cases you even lose your sense of smell and taste.
Wow, that sounds really scary. My next question is, how contagious is COVID 19? How does it spread?
So, COVID 19 is extremely contagious. It spreads through respiratory droplets that are caused by a cough or sneeze. Since it travels through the air, it makes it far more widespread than, say, the previous threat of like Ebola. This is why the Center for Disease Control, the CDC, recommends people stand at least 6 feet apart from each other to lower the risk of transferring the disease through these respiratory droplets. Even inhaling someone's breath or talking closely with them can transmit the virus. It doesn't have to be just coughing or sneezing, so it's very dangerous. That's why it's important to practice social distancing. It is also important that if and when we are to be in contact with people, we protect ourselves by wearing a mask or wearing gloves. This can also help prevent the disease from spreading even further. That is especially important for healthcare professionals and essential workers. And what's also scary is that COVID 19 can also be asymptomatic. And what that means is that a person can be already infected with the disease, but not know it because they aren't displaying any symptoms. This can be very dangerous because this is another way COVID is so easily spread, especially amongst the youth. Um, People are going about their their daily activities not knowing that they're infected because they are asymptomatic and they risk infecting someone else.
Yeah, not everybody has been tested or they have that access to get tested for COVID 19.
Right, exactly. So, we really recommend for everyone to stay home. And if you can't be at home, just to practice social distancing as much as possible, because a lot of times the youth can be carriers of the disease because they don't know that they have it. So, we don't want to risk them bringing it home to their elders or somebody with a weaker immune system.
I know you said that elderly people and people with existing conditions are the ones that are at high risk of getting COVID-19. And a lot of teenagers, they don't really constantly think about washing their hands or coming home and washing their hands from being outside or whatever it is. I want to ask you, are teenagers at high risk of getting COVID-19?
Of course. The misconception and the reason why we feel that teenagers aren't taking this seriously enough is because we keep hearing on the news, through our friends and through our family, that this disease affects only seniors. And we keep hearing that it's sort of like an elderly disease. But the problem is that youth can be affected. Teenagers can absolutely be infected with the disease. They may not experience the severity of the disease, but they are at risk of carrying it onto someone else. Actually, people age 18 to 49 make up 53% of the total cases in New York altogether. The youth however, have lower cases of the extremities of the virus and may mostly be asymptomatic. Because of this, children and teenagers are at most risk of becoming carriers and passing this disease on to others, most seriously to older and sicker members of their family or social circle. So some of these extremities can even be fatal. So although some teenagers may have stronger immune systems and think that they can beat this, that's probably true for the most part, but someone in their home may not be able to overcome this disease. So it's really important that teenagers know how important it is for them to stay home, because and to practice social distancing and to practice these different hygienic strategies so that they can be well protected and protect the people around them, because we can't risk for the younger population to carry on the disease to the older population that may not be able to fight it.
And it's really scary because a lot of teens, the youth, like I can still see some of them, you know, not practicing social distancing. They're still kind of hanging out with their friends, or they're still meeting up with some people, or they're either like not taking it seriously because they think that they're immune to it, when realistically they're not. Which my next question is, how should the youth self isolate? Like, how should they practice self isolating and, staying away from others so they don't get their parents or their grandparents or the ones that they love sick?
So, what I like to stress a lot when it comes to social distancing and staying at home is that staying at home, of course, is a privilege. Not everyone is able to stay at home. So, if you have the privilege of staying at home with your family, please do so. Go outside only if you have to. For example, if you need to make a grocery run, make sure you stock up on enough items to last for days so that you don't have to frequently go outside. Also, don't have any visitors come over. Don't go over to your friend's house. The CDC recommends gatherings of only 10 people or less, but I strongly recommend no gatherings at all, because you don't know the other social distancing or hygienic practices of the people around you and the people you may be inviting into your home.
Yeah, you kind of answered my next question, which was, can we still go to our friend's house? But obviously, like, that's not the best idea right now, ideally.
No, please. No. Do not go to your friend's house, because this is all a ripple effect, right? So if you are going to your friend's house and let's say one of their parents is an essential worker and they're still going out of the home every day, we don't know. You don't know how many people that their parents are coming into contact with. You don't know the parents' hygienic practices. You don't know the siblings' hygienic practices. So it's just really important not to go to friends' house, because you don't want to put them at risk. They don't know where you've been. They don't know your practices, so well, or your siblings or your parents. So to just to just limit the risk of passing it on to others or even infecting yourselves or your family, we recommend do not go to your friend's house. I know it's tempting. I know this can be really boring, but it's really important to just stick this out as long as possible so that we can stop the spread.
My next question is, are there any hygienic practices that we should start or do more of during this time?
So the first thing I recommend is just wash your hands. Wash your hands throughout the day, especially when entering your home after coming in contact with animals, people, packages, or your work environment. Wash your hands before and after using the bathroom. Be conscious of whenever you come in contact with anything that has entered your home from the outside, just wash your hands as much as you can throughout the day. Wash your hands. Do not touch your face. It's so important to wash your hands because the virus enters your body through the mucous membranes of your eyes, nose, and mouth. When you touch your face with unwashed hands, you are bringing the virus to these sites on your face. Besides washing hands, you can also sanitize your hands. Wipe down and sanitize groceries or any items coming into your house. You can use Lysol wipes. If you don't have Lysol wipes, as we know, they're like pretty much out of stock everywhere. I tried getting some Lysol myself and I had no luck. You can also use like a pad and alcohol just to wipe down your groceries or any items coming into your home. Clean your produce. When you do have to leave your home, wear mask and gloves. Never touch your face. If you are experiencing coughing or sneezing, please cover your mouth. Beware of cross contamination by removing and replacing your gloves when exposing your gloves to something unsanitary. So it's really important to switch out your gloves throughout the day if you do happen to be outside. Or if you do happen to still be working, it's really important to try to switch your gloves out as much as possible throughout the day so you're not cross contaminating.
Do you have any recommendations or any exercises or activities that the youth should start doing?
I think it's best for, well, my advice to the youth is to please remember that a short-term sacrifice of your daily routine is the only way we can overcome the virus. It is all about social contact. So, this is how the virus spreads by socially, engaging with other people and being outside of your home, not complying with the guidelines by CDC. So be conscious of your surroundings. Please be mindful that not only are you at risk of becoming infected, you are also at risk of passing the virus on to someone who may not be able to recover from the virus. So, I mean, the best things I can tell the youth right now, I know it's a really trying time. And like I said, it's very boring, but try your best to just catch up on schoolwork. You can also stay in contact with your friend via Zoom. Me and my friends sometimes get together in Zoom conferences, just to check up and see how one another's doing. We also understand that this virus has, it's it has an emotional breakdown level to it too, because you're not in contact with the people you're used to being in contact with, and we know it can be really overwhelming to not have that physical contact with your loved ones. I haven't seen my mom in about 3 weeks, so it can be really overwhelming. So you can try things like Zoom. I taught my grandmother how to FaceTime on WhatsApp the other day, to connect with your elders, just try to keep busy as much as you can.
So, my last question is, if youth and families wanted to learn more about and get in contact with the Healthcare Education Project, how can we do that?
My email is Jocelyn period Lebron at 1199 funds with a D FUNDS.org. You can contact me via email. And if you'd like, also, you can follow us on social media. I have an Instagram account. It's at HEP in the Bronx. And I try to post as much as possible on our Bronx Instagram with resources for adults and for the youth, so that they can keep up with what's going on in the Bronx. Um, you can follow us on Facebook. We have I believe our Facebook is HEP New York. You can follow us there. But all just be sure to email me if you have any questions or concerns, or if you'd like to bring some resources to your community in the Bronx. I'll be more than happy to help.
Thank you so much. I want to ask if there's any like last minute things you want to say for the Bronx community for Open 2.0.
Oh, thank you. I did want to just mention that if you know anyone who has come in contact with the virus, There are two testing sites in the Bronx. They're not public per se, but you can make appointments if you'd like to get tested just to be on the safe side. There's one in the Lehman College parking lot, and there's one at Bay Plaza AMC Theater. So I'll also leave that information with you because they have certain times of the day, and there's numbers that you can call to make appointments.
Thank you so much, Jocelyn Lebron, for joining us and for giving us all this information and advice, and for you guys at home for tuning in. Thank you so much for tuning to Open 2.0, and I hope I could see you guys next time. Bye.